Today on the podcast, we are heading out to Muskegon Surgical Associates, to talk to Dr. Steven Zonca about the new surgical suite opening up at the Plastic Surgery Center. As I said, my guest for today, back from Muskegon Surgical Associates, Dr. Steven Zonca is joining me. Dr. Zonca, how are you today?
I'm doing great, Eric. Thanks for having us on.
I am so excited to talk about this because I feel in your industry, not only is this sort of a trend that offices are trying to accomplish, but it's also, in many ways, better for the clients in ways that they might not perceive, and pretty obvious ways, right? And building your own surgical suite inside the offices is pretty amazing, my friend. Can we talk about that?
Absolutely. So we're building an accredited surgical facility, and some of the advantages are the privacy of being right in the office versus the hospital. And this is for cosmetic surgery, elective procedures. And over the past 2 years, as we've seen healthcare resources at the hospital be more restricted and restrained, we realize the need for something outside the hospital setting. We still need the hospital, but there are certain things that don't have to be in the hospital. And so that's what we're trying to provide, a more private and more nurturing environment here in the office. The hospital has its role, but it's difficult when you have a whole lineup of patients to provide from the hospital standpoint, to provide the detailed attention. Of course, from the surgical side, we still take great care of patients, whether it's here or in the hospital. But when you have a hospital full of sick people and there are no beds available, it's more difficult from the hospital side to take care of, to provide that extra comfort and TLC that we are able to provide here in the office.
And not only that, but this is a crass way to explain it. So allow me to be crass for a second, then move my way backwards. This sort of one-stop shopping, that's the crass way. But this ability that I can come in and I can get a consult, and then I come to the same place to do the procedure, adds a level of comfort, I would imagine, to your patients, where they don't have to go to either the hospital, or in some cases, in some parts of the country, they would go to a different surgical suite. So they've now, you and I were talking before the podcast about bumping into neighbors or people that you might not want to bump into. You're almost doubling that opportunity when you're just going to another building.
Absolutely. And so it's a more private experience, and it's a familiar place, and we have easy parking here. We don't have to walk a half a mile from the corner of the parking lot
Right
by the hospital because it's busy and full. And again, those are all places where you might run into people that you might not want to have to explain why you're at the hospital today.
Now, you alluded to earlier with the stress on the system from COVID. What was the impetus to start building during COVID, and how far along are you to opening this surgical suite?
So we're already well into we've applied for our inspection for our certification, and the construction is nearly complete. And so we're very close to being ready to, within the next month, we've got almost all of our equipment in place. And so we're just waiting on a few details to finish up before we're underway. What we found over the last 2 years is that the hospital, in taking care of with the pandemic, very sick people, the hospital's resources were strained. There were times when elective surgeries were not allowed at the hospital because they simply didn't have the bandwidth to take care of them. They didn't have beds available. And even when they did have beds, there were times when other supplies, whether it be nursing staff or simply supplies, were constrained. And so things had to be canceled. And it provided some insight as to, well, we should be looking at taking care of these patients in a less intense environment, and something where we can provide a better patient experience. And certainly when someone signs up for surgery, they don't want to be canceled. They've taken time off of work and for recovery, and their family has taken time off of work to bring them. And when we have these unexpected cancellations, that's not a great patient experience either. And everyone understands, because it's been unprecedented times over the past year, but we have a lot more control over what's going on under our own roof than when we're at the hospital, where we have patients that have to have interventions that or have to be in the hospital, and there were sort of just no beds available at certain times throughout the past 2 years.
And I think the other thing that you're sort of being a bit humble about is that MSA has been growing at this exponential rate as well. And I think those two things coming together brings us to where we are today.
We are very happy with the staff and the great teamwork that's been built around patient care and providing a great patient experience here in the office as well as at the hospital.
Absolutely. And as you said, you're a month or call it 6 weeks out from being ready to do this. If people want to start getting a consult and being part of this process, what's the best way for them to do that?
Either call our office or through our website, schedule an appointment, and so that we could evaluate and see if you're a good candidate for a procedure or a minimally invasive, whether that be like Botox or fillers, or whether maybe someone needs a little nip tuck or a little lift. Those are all things that we can evaluate first in the office and see if you're a great candidate for, like I said, something minimally invasive or maybe something surgical procedure.
Now, Dr. Zonca, we are heading into the holiday season. People are going to be outside less and maybe in their homes more. Is there something that patients should be thinking about this time of year and why they should reach out to you guys, especially this fall winter season?
The fall is a great time for rejuvenation. People are back at work and the kids are back at school. Things are sort of in people are covering up just a little bit more, and so a little bruising and swelling go hide very nicely under a sweater or a pair of baggy pants for a couple weeks while we recover. And it's a great time to get yourself in the best shape. Just around the holidays, many people have time off where colleagues at work wouldn't even have to know that they needed time off for a recovery for a week or so. So it's a very popular time of year for minimally invasive things, Botox and facial fillers, but it's also a time when people are taking advantage of the back to school routine and the back at work routine where they can recover without being noticed.
Dr. Zonca, as always, a pleasure. Congrats on the new surgical suite, and we will talk to you again soon.
Thank you, Eric. Have a great day.